Welcome to Parasitic Diseases. Today we're going to discuss whipworm, or Trichuris trichiura as it's better known as. And we'll see why it's called whipworm when we look at its morphology. And in fact, you can see an example of a Trichuris worm here, and it's called whipworm because this is the handle of the whip, and this is the whip end of the whip. So its geographic distribution is a little bit different now than Enterobius vermicularis, which was worldwide. This is worldwide too, but it's restricted to the subtropics and the tropics. And as you can see, the African continent is inundated with Trichuris infection, as is the Indian subcontinent and most of Southeast Asia, throughout Indonesia, into Borneo. Madagascar has lots of infection. There are some places throughout South America that's also true. This is Bolivia, by the way. And certain Central American countries have high rates of Trichuris infection, as does rural areas of, let's say, Puerto Rico and Cuba. We've known about Trichuris for some time, as you can tell, because Linnaeus actually named it Trichuris trichiura. It was first seen by Morgnani in tissue, but he didn't actually know what he was looking at, although it was a jumble of worms, that's for sure. And Roederer eventually worked out what Morgnani was actually looking at and isolated individual worms and worked out a portion of its life cycle as well. So it's been known about for some time. It's a visible worm. The worm is several centimeters in length and occupies a portion of the large intestine, as we will now see. There are clear differences between male and female worms. The female has a straight tail, as we show here. This is isolated from the host, by the way. The tail is wider than the head. And the male turns out to have a curlicue tail, and this is typical for a lot of nematodes. I found this very interesting because I happen to live in the New York City area, and there's a park in New York, on the west side of New York, down in the lower west side, that actually mimics the shape of a male Trichuris, and so I call it Trichuris Park. You can see the tail of the worm here, curlicued up, and here's the whip end of the worm. And I'm sure they didn't mean for this iconic figure that actually rings the entire park in this particular portion of New York City to represent the fact that if you go here, of course, you will acquire Trichuris. I'm sure that's not what they had in mind, but it's ironic to see the same shape repeated. So this is a clear-cut case of art imitating nature. Its life cycle is direct, just like that of Enterobius. It begins with an individual ingesting embryonated eggs, and these eggs, unlike the Enterobius eggs, can survive for much longer periods of time in the environment than the pinworm eggs. These eggs, if the conditions are right for the egg to survive, can last months to up to a year in a layer of sewage treatment called Schmutzdecke. And we know this because we have studied the organisms that can be transmitted from human to human in sewage treatment plants. If we were to use that as a fertilizer for our crops, we run the risk, of course, of transmitting this infection from person to person wherever it's found. Once the egg is ingested, the egg actually hatches in the small intestine, but the larva that's released, remember, all nematodes undergo 4 molts to become an adult. The larva of Trichuris then is passively carried to the transverse section of the large intestine, again, basically where the pinworm adult lives, although the adult of pinworm lives a little bit further down over here as well. This worm, unlike pinworm, however, is an invader. It actually penetrates the columnar epithelium of the large intestine and becomes a tissue parasite at this point. As the result, there are pathological consequences of encountering infection with Trichuris, particularly heavy infections of Trichuris, as indicated here, and we'll discuss this when we discuss the pathology. But let's continue with the life cycle for a moment. The male and female worms locate near each other as they mature, and this takes about 3 months for this larva to actually grow from a first stage larva to an adult worm. And at 3 months, the infection becomes patent. So that happens every 6 weeks in Trichuris, in Enterobius vermicularis infection. But in Trichuris infection, it doesn't even begin until 3 months afterwards. So if you've traveled to an area where Trichuris is endemic for vacation, let's say, and you come back on your vacation and you're starting to feel a little bit sick and you have some diarrheal disease and you go to your doctor and you say, I think I might have picked up a parasite in my travels. I sort of ate street food while I was there, and some people had told me about some places that were good to go and eat. And I suspected that the sanitation wasn't 100%. And I think I might have a parasite. Well, if the doctor starts to look for these parasites, particularly Trichuris, and if it's been less than 3 months, they're not going to find any because the worm hasn't matured enough to start producing eggs. But the moment that does occur, the female adult worm, the portion that lays the eggs is actually not in the tissue phase. The whip portion is. The other portion of the worm, the handle of the whip, is actually stuck out in the lumen of the large intestine. And this allows the eggs from the female worms, once they're fertilized, to be extruded into the feces and out into the environment. And that completes the life cycle. The eggs in the environment, when they first enter the environment, take about 2 to 3 weeks to embryonate to infectivity. So a newly passed egg is not infectious, whereas with Enterobius, as I mentioned before, within 6 hours that egg is infectious. In this case, it takes 2 to 3 weeks. So let's talk about why this worm can create a disease state. First of all, let's look at where it lives, and as you can see, it's intimately connected with the tissue. Here's the tail end of the worm shown out over here in the lumen. This is a scanning electron micrograph of a related species, Trichuris murus, but it lives in exactly the same niche as the human variety, Trichuris trichiura. So we can make some analogies here. And this is a good organism to use in the laboratory for looking at some of the pathological effects of the infection and trying to relate them to what happens in humans as well. So it's a good model. So we see the worm is out over here. Here are some eggs from the parasite being extruded out into the fecal mass. And this portion of the worm lies within a syncytium of cells created from the epithelial cells that the larva originally infected. And this worm now lives as an intra-multicellular parasite. At least the head of the worm lives that way. And that's where the nutrition from the host is derived by the parasite, although we know nothing about how that actually occurs. We don't know what the nutritional requirements are for this worm. We don't know how its metabolism creates the biomass to produce some 2,000 to 3,000 eggs every single day. And it can do that for up to 3 to 5 years. And that's a huge amount of biomass for this parasite to process from the host and then to use as a way of disseminating itself out into the environment. To do this, to live where it lives, this parasite has to have some very unusual secreted molecules which alters its environment to match the requirements that it needs in order to carry out its life. And one of those secreted proteins is a pore-forming protein, not unlike other pore-forming proteins. And we'll discuss one that, in fact, we've already discussed this parasite protein because we discussed Entamoeba histolytica. It too produces a pore-forming protein. Its purpose is totally different, but it's similar in the way it functions. This heavy infection with Trichuris, of all species, but particularly Trichuris trichiura, may play an important role with regards to the anemia and the subsequent diarrhea that develops as a result of heavy infection with this parasite. We do know, however, because we've looked extensively for evidence for blood-sucking activity of this parasite and have found none. So the cause of the anemia is thought to be a central bone marrow failure rather than a bleeding episode at the point of attachment of the worm itself. As we'll see some other nematodes, we can acquire anemia as a result of the behavior of the worm at the site of attachment. Hookworm will be a good example of that. But Trichuris doesn't seem to do that. So it must be secreting other molecules that alters the behavior of the host in some adverse way to create this anemia as well. What advantage that has for the parasite is still very much up in the air. Nobody really knows the answer to that question. But we do know what happens when a small child, let's say a child that's between 2 and 5 years of age, that's just learning how to walk, gets out into the environment. Remember, I indicated in our introductory session that pica is a habit of small children, putting small things in their mouths, inanimate objects in their environment, particularly in subtropical and tropical environments where they are allowed to wander freely around the house and out of the house. They can easily encounter the eggs of this parasite, and if they're embryonated and contain a larva, they can become infected. So heavy infections in children take its toll on development and cognition. And we see here diarrheal disease, which of course is a calorie-limiting symptom of a disease that requires a secretory process as well as a rapid transit of material through the gut tract. It doesn't develop into a bloody diarrhea or a dysentery. It remains as diarrhea, even though the infection is quite heavy. And again, the anemia that develops, because it's not a dysentery, is attributable to some central bone marrow failure event. And because of these two things playing off of each other, the child can then, if chronically infected, and remember, these parasites can live for 3 to 5 years in situ, they can develop a malnutrition, a protein-calorie malnutrition, which then plays into their lack of proper development throughout their early childhood and affects their cognitive skills. And of course, it impacts them directly as an adult. Now, Dr. Daniel Griffin is going to give a clinical vignette illustrating further the pathogenesis of this infection.
A woman in her 50s who is an immigrant from a rural area with limited resources. She ends up being admitted to the hospital with iron deficiency anemia and eosinophilia. Because this woman is over the age of 50 and has no history of prior colonoscopy, they decide to go right for a colonoscopy. On colonoscopy, a long, slender, serpiginous object is observed and recovered. What is found is about 4.4 centimeters in length, so about 2 inches long. One end is very slender, while the other is large and curled, but not blunt. This is sent to the parasitology laboratory for identification. So let's talk a little bit about clinical disease. Now, clinical disease occurs mainly in children. Those with very heavy Trichuris infections are either going to present with dysentery or with chronic colitis. The induced dysentery results in weight loss, emaciation, and anemia. Unfortunately, because of the extensive mucosal swelling in the rectum, there's this urge to strain, even when feces are not present and even when feces are present. So a tenesmus can develop. When this goes on for a long period of time, we can actually even end up with rectal prolapse. Chronic Trichuris colitis in pediatric patients can resemble characteristics of inflammatory bowel diseases, so there can be a confusion there. Children suffering from heavy infection can develop chronic malnutrition, short stature, anemia, and finger clubbing. Now, following specific chemotherapy, many of these conditions abate, and the kids will actually have rapid catch-up growth. Increasing evidence suggests that in addition to the physical symptoms of trichuriasis, chronic infection can produce long-term deficits in cognitive and intellectual development. It's not clear if one waits too long that these will all be reversible. Now, this is sort of a striking picture of a prolapsed rectum. This is in an adult who's had that feeling of tenesmus and has continued to strain. Now, what about diagnosis? Trichuris eggs have a characteristic appearance and are easily identified in experienced hands. In cases of light microscopy, the concentration of feces prior to microscopic examination may be required. Now, a search for pathogenic protozoa is usually indicated because you have a lot of multiple infections. So you want to look at the context and make sure that you're not just having a single infection, because you may end up needing to treat for multiple pathogens. The adult Trichuris worms can sometimes be identified by direct visualization on colonoscopy. Now, we'll make the point here. this parasite has a cytoadherent ability. So it's not really going to be falling out into the stool. So if you see worms in the stool, it's usually not going to be this pathogen. Now, failure to control diarrhea after Trichuris is eradicated, again, suggests you want to be looking for these other causes. In histological preparations, the Trichuris adults can be readily identified by their characteristic variability in their diameter in different sections. Now, let's look a little bit at the egg. This is really a classic egg, fertilized unembryonated egg, embryonated egg. What about treatment? Now, the preferred treatment is mebendazole. Now, in the United States, mebendazole is not something that can be obtained, so we often use albendazole, but it is an inferior alternative. With mebendazole, you're doing 100 milligrams twice a day for 3 days. The albendazole, you're doing once a day for 3 days, but you're going to have a higher rate of failure. It is important to avoid in the first trimester of pregnancies due to teratogenic concerns, right? So you're going to have harmful effects on the fetus. So in deworming campaigns, children under 6 months of age are also often not treated, in addition to avoiding treatment of pregnant women during the first trimester. Here is the drug of choice, not available in the US. Now, what about our patient? Now, the worm was identified as an adult Trichuris trachea, and the patient received 3 days of antihelminthic therapy. The patient did well and had improvement of anemia as well as other issues.
Now, there's an interesting sidebar to Trichuris infection, which I would like to talk about just briefly, and that is there's a condition known as inflammatory bowel disease, and you can throw Crohn's disease into that mix as well. People suffer from this on a regular basis throughout many, many different places throughout the world, but particularly in the developed world. And the cause of inflammatory bowel disease has escaped examination in the laboratory and in clinical practice. We're still not sure as to how these two conditions arise, and we're, of course, still not sure about how to treat them as a result. One of the interesting findings is that when you look in areas where gut infections are very high, particularly with regards to nematodes, you find very little inflammatory bowel disease and almost no Crohn's disease whatsoever. And when families are studied, those living in endemic areas and some of their family members have moved to areas outside of the zone of transmission for these infections and have been treated and then live out their lives in those new environments. Many of them, not a lot, but enough to allow a statistically significant number to be included into the group of inflammatory bowel disease. So even coming from an area where it's unknown and then moving to an area where the parasites don't exist, but the inflammatory bowel disease does exist, these patients can convert to that pathological condition. So the thought was that perhaps worms in some way prevent these two conditions from developing. It seemed like heresy at the time of suggestion that maybe we can interfere with the development of inflammatory bowel disease by simply giving a small dose of helminth, in this case, Trichuris infection, to a person. And because it's such a horrible and long-term chronic disease, and in some cases even a lethal disease, some internal review boards for hospitals actually allowed these studies to be carried out on a limited basis with success. So there are other species of Trichuris that can be used. They will institute infections in humans, not as severe as the human variety, Trichuris trachea. And as a result, if you give this infection on a low dose number to, let's say, a patient with Crohn's disease, in a lot of instances, the Crohn's disease was modified, became less severe, and in a few cases actually went away, only to return when the worm infection was finally fought off by the host immune response and the patient returned to their original state, parasite-free. So today there is a host of studies going on throughout the world to try to find out what the basis for this interference with the development of inflammatory bowel disease, from a variety of helminths, not just Trichuris, but it's been found to be true for treatment with low numbers of hookworm and several other helminths as well. So here's a good article. It was written in 2008, and it summarizes all the information that was known up to that point with regards to the use of helminths to interfere with this more serious problem of bowel function. Preventing and controlling Trichuris infection is quite simple. If we have sanitary disposal of feces, the problem is gone. Remember not to use the Schmutzdecke that's created by this commercial treatment plant, water treatment plant, because the Schmutzdecke layer is very rich in nutrients, and the temptation is to use that for some kind of a fertilizer process. But if you were to use it, it then has to be treated first. It has to be heated high enough to kill all the microbes in it. And when you do that, you lose a lot of the nutritional value of the Schmutzdecke layer to begin with. So it's trying to fit a square peg in a round hole, basically. But nonetheless, there are still some communities that are processing their solid wastes from treatment plants to be used in an agricultural setting. The best way to handle this infection is to get rid of it altogether, and that's what the good old outhouse does. If the hole is dug deep enough, let's say 10 feet or more, most of them are between 6 and 8 and 10 feet deep, the deposits at the bottom would never rise to the surface, so to speak, and a well-maintained outhouse is cleaned out once a year anyway, especially in campsites. So that's the best way to take care of. The problem is to get rid of it. Don't use drugs to control them in populations. Use good sanitation. But of course, that's not always possible. If you want to learn more about helminth therapy, a more recent article than the 2008 one that I referred to before, in 2015 shows how this might have evolved into a real treatment process. We've talked about Trichuris at least 3 times on TWIP, and you can access TWIP on microbe.tv/TWIP. Next time, we'll discuss ascariasis caused by Ascaris lumbricoides. Thanks for listening.